Hi, this is Dr. Christine Zorad, and I am going to help answer the question, why would an infant need to see a chiropractor? If we can start with the health of the mom and the health of the pregnancy, that's a good place to start. If you have in utero constraint or there's not enough room for the baby to move and to get into a good position for birth, that can set up a situation where you're born with some nerve interference. And how this can happen is if you're not in a good position and you don't have room to move around the way you're supposed to before those last few months of pregnancy, your baby can get stuck in different positions. Let's say their head gets stuck over like this and stays that way for a month or two. What if their head gets stuck like this and stays that way for a month or two, and it's like this with every contraction? I don't know about you, but if my head was stuck like this for a couple of months, that would be pretty sore. So, and then coming down the birth canal, the little skull will condense. These plates are movable, and they will come in so that the head is smaller to come through the birth canal. And then after you're born and you start to cry, those first cries then set the sacral occipital rhythm with the baby, and these plates then can pop back out into a normal position. So it's a good idea to check that to make sure that all these skull bones are aligned the way they're supposed to be, even inside the mouth, because that palate is part of the skull, to make sure that the palate has a nice vault so that those plates have been able to come back out and be where they're supposed to be. So we also check the upper cervical. We check the occipital sacral system to make sure that things are functioning, at a high level, and that there's no stress or tension up here at the base of the skull. So those are some of the things that we check for right when they're born. After the baby's born, some things that you could notice would be if you're trying to nurse and your baby can't latch on. That's a sign that there's some tension and some misalignment up here at the top of the neck. Also, if they can nurse on one side but they can't turn their head to nurse on the other. Those are some of the questions that we ask when new infant patients come to the office, of course. As you get older, then there would be colic and lots of crying. Babies aren't supposed to be crying all the time. We're supposed to be comfortable and happy. So lots of crying, colic, just uncomfortable, reflux. Those are things that children get when they're really young if they have some tension and misalignment. When they get a little older, that can lead to ear infections, asthma, food allergies. There's a whole host of things. If the nervous system isn't functioning and you have lots of tension and congestion, then you're going to have some other health issues that can develop. Then as kids learn to walk and they move around and they fall a lot, some of those falls can cause some structural misalignments that then can lead to some nerve system misalignments. There's lots of reasons why it would be a good idea to have your infant checked. If you go to the International Chiropractic Pediatric Association, there's a list of certified pediatric chiropractors. I'm a certified chiropractor in pediatric here in Omaha. If you have any questions about infants and chiropractic and techniques, I'm available at 402-210-8490. And rest assured that the amount of pressure that you use to adjust a little baby is about the pressure that you would place on your eyeball. So if you shut your eyes and put your finger on your eye and place a little bit of pressure, that's pretty much what we do. I hope this has been helpful. Get your kids checked. Doesn't matter if you had them checked at birth or if they're 5 years old and they haven't been checked yet, go get them checked. That early childhood development is an important time to have all your nerve function. So, thanks a lot. I hope this helps.